Hi, Shayna. How are you?
I'm good. How are you today?
I'm good. I'm good, and I'm glad to be here and doing this webinar on radiographs.
Yep.
I think it's an important topic, and there's one that there's some confusion because the candidates don't have to take the radiographs. So what are they responsible for? What are they being graded on? And what happens if they're not perfect? So I think it's great that we'll take just a few minutes. I think will be brief, but just take a few minutes to just clear up the responsibilities for radiographs and hopefully make this group of candidates less nervous coming into the exam. That's what these are all about, to try to reduce the stress level so that they have all the answers.
That's great. We'll start this presentation, and matter of fact, it should pop up right now, and you're set to go.
Okay. So hello and welcome. We're glad you're here. I'm taking the time preparing for the exam. I think we always say the videos that we do are not a replacement for the manual. Think of it as an addition to the manual. For those that are visual and auditory learners, maybe it's an easier way to learn, but please make sure that you are also reading the manual for this information. So let's talk about the requirements. We have eligibility requirements, a medical history, a blood pressure, and radiographs. Today, we're going to be talking about the radiograph eligibility requirement. The radiographs that we require do not have to verify the presence of calculus. We are not evaluating the technique. They don't have to even be exposed by you. A panoramic radiograph or a full mouth series exposed within 3 years is acceptable. We do not have the requirement of bite wings. What you are going to be graded on or evaluated on is your ability to assess and select images that are of diagnostic quality. So what do we mean by diagnostic quality? We mean that the particular image has to be clear enough with no technical defects that would stop us from being able to diagnose caries, perio health, or any other dental disease or abnormalities this is the critical, of the teeth being treated. The apices of all fully erupted teeth within the case selection must be visible on at least one of the images if you have a full mouth series. And the only exception to that is the distal root of the third molar in the primary quadrant. So we must be able to see the apices of every root of every tooth within the case selection, with the exception of the distal root, the apices of the distal root of the third molar in that primary quadrant. So when we talk about diagnostic quality, we're talking about diagnostic quality of the radiographs for the teeth being treated, and that is the case selection. If there's cone cutting or overlapping or something that is what we would consider not to be diagnostic, but it's in a quadrant that you are not treating, then it's ignored. You're not being assessed on your ability for determining if it's diagnostic or not.
So my one question here is, if I did not expose the radiographs, the dental office did or the patient had them, but I turned them in as being diagnostic quality, they are then my images. They are what I'm submitting. Is that correct? I mean, if they're not of diagnostic quality, I either need to retake them to bring them up to diagnostic quality for submission of this exam.
Right. The radiographs that you submit are your responsibility, and what you're saying is that they are diagnostic, whether you took them or you didn't. You're saying that they are diagnostic.
Okay.
Yes.
Great.
All right, next slide. So another requirement of these radiographs is that they are a depiction of the current condition of the patient's mouth. But if these radiographs are not, then you must explain this on the progress form. What may have happened is the radiographs may have been exposed 2 years ago. The patient has had an extraction, has had some additional fillings, whatever the dental treatment. You don't need to re-expose the patient or re-expose the radiographs. All you need to do is on the progress form and on the front under the candidate notes section, just write and explain the treatment that has occurred since the radiographs were exposed. So by looking at the radiographs and by reading your notes, we will have the current depiction of the patient's mouth. It will represent the combination of the radiographs and the notes. It will reflect the representation, the current representation of the patient's mouth. Other things that you need to do with the radiographs is that they need to be mounted correctly. They need to have the patient's name and the exposure date. That must be clearly so that we know that the radiographs belong to the patient that you're treating. They have to be marked with left and right. And if there's anything on the radiographs that have your school affiliation or your name or anything that would identify you, please make sure that they're covered. Remember, this is an anonymous exam. You don't sign any of the paperwork or whatever till after the exam to maintain that anonymity, and we want it on the radiographs too. So if there's any school affiliation or anything that would identify you, please cover it. You also have to have these radiographs printed on quality paper. We are not enforcing that it be photo grade paper, but it must be quality paper. When we look at the radiographs, we have to be able to look, and they must be diagnostic. Again, we should see, we're not grading, but we ought to be able to see caries or periodontal health. We don't want it to be grainy. We want to make sure that we can see the apices, that the contrast is good enough. So please take the time and be careful with your printing process to make sure that you are providing us with a good quality print. Even if you're going to be displaying your radiographs on a screen at the operatory, digitally, we also need to have a printed copy available to us, okay? So please do take the time and make sure that your printing is good and that there is good contrast. So here's an example of Panorex. Remember, the requirement is that they be taken within 3 years. And Panorex is a nice, easy way to be able to see the apices of all of the roots of the teeth within the case selection. So that's an easy way to do it. Here's another acceptable submission would be a full mouth series. Again, the requirement is 3 years. If you do have bite wings as part of your full mouth mounting, that's perfectly okay. We don't require them, but we welcome them. If they're there, please submit them. In this particular full mouth series, you can see that at least on one image, the apex of just about every root within the mouth. So a case selection could be any quadrant in this mouth, could be a primary quadrant. Easy because there's no third molars. So that's basically, as we said, it was going to be short. The diagnostic requirements for this are pretty clear cut. Just please make sure that you look at your radiographs carefully and make sure that you determine that they are diagnostic. If they are not, then take care of it before the exam and make sure that what you bring to the exam that day is of good copy quality and are diagnostic. This is our map. We always say that we think you made a good choice taking the CDCA 8X exam. This is our accepted states. Our goal is to have everything purple in a short period of time. That's what we're striving for. But as when you successfully complete this exam, this is, I say, your ticket to travel. You can apply for licensure in any of these states, as well as Jamaica and the Virgin Islands, U.S. Virgin Islands. So thank you for tuning in. I hope this clarifies any questions you might have about your responsibilities for radiographs. And I'm going to turn it back to Shana to give you a little bit more information.
Yeah, thanks, Pat. We appreciate everyone's time today in participating in the Radiographs webinar. Candidates, if you have additional questions, you can reach out to us on our website at cdcaexams.org. Select Contact Us, and you can go to the Candidates Questions button and ask any question you have. Educators, if you also have questions and happen to be watching this, you can reach out to me at soberfelt@cdcaexams.org. We thank you for your time. We're glad you're here. And you know what? We'll see you out on the examination trail very soon.
Look forward. Hope we see you at an exam.
Bye, Pat.
Goodbye. Thanks, Shana.